physical, mental and social well-being of all the functions and processes related to reproduction, including reproductive organs. So if for a lay person's point of view, if we can say that this is a vision where every child is wanted, every birth is safe, every young person is free of HIV and infections, and every girl and woman is treated with dignity. So this is, in a nutshell, would be a reproductive health.
What are the components? Does it include pre-delivery healthcare for the woman?
It talks of adolescent reproductive sexual health also, which means the pre-marriage preparation, pre-marriage education, life skills education, when to say no to sex, when to say yes to sex, what is the important needs of nutrition during adolescence. So all that is a part of reproductive health. So pre-marriage preparation in terms of adolescent reproductive sexual health, not necessarily marriage related, but in terms of general improvement in health and development of adolescent girls and boys, is integral to the reproductive health.
What about the fact that you have to take folate and iron during the pregnancy period? Is that part of reproductive?
That's absolutely the part of reproductive health, because we want that every pregnancy is safe, every birth is safe, and if she goes for regular antenatal checkups, she gets the examinations done, she gets the supplements of nutrition which is given by the government program, she goes to a proper place for delivery, especially now in India there is a heavy emphasis on institutional deliveries. You must have heard the Janani Suraksha Yojana, where the poor women are being encouraged to deliver in institutions and they're giving monetary incentives so as to offset the opportunity cost for seeking care, and which has shown really encouraging results.
So you would say it's adolescent sexual education, it's nutrition and medical care during pregnancy, it's pre-conception medical advice.
Pre-conception and medical advice is not that much in vogue over here. It might be a little alien concept to the Indian this thing. But what we definitely do is that we do talk to newly married couples and talk to them in terms of how important it is to delay the first pregnancy and how important it is to seek the timely care and use contraceptive if you really want to delay the pregnancy. So all that is there, but we don't call it pre-conceptional. We call it in fact advice and services for newly married couples.
Okay. So if, I do not want to put my words into so what are your 5-6 components? Where does it start? Adolescent sexual education.
Adolescent sexual reproductive health is one component where we talk of preparation, education, we want of services of adolescents, services to adolescents. Then we talk of maternal health, which means the antenatal care, the school attendance at birth, the postpartum care. We talk of services for safe abortion, which are in the countries where the abortion is legal. I mean, this is something which is important to remember, because UNFPA or globally, the agreement is that wherever the countries abortions are legal, abortion should be done safely and should be done early, so that you avoid the maternal morbidity, because abortion, unsafe abortion still constitutes a major cause of maternal mortality. So it's a maternal health, it's safe abortion services, it is family planning, so it's to see that every child is wanted and you decide on family size and timing. So this is family planning. Then it's also the HIV prevention in that sense, because every act of sex will be infection free. So you avoid STIs, sexually transmitted infections, reproductive tract infections, and HIV itself. Plus some of those practices which are in terms of, like the India, it's not common, the genital mutilation, the female genital mutilation.
The clitoral...
clitoral and all, but that's not, common in India, except in maybe certain places.
And then plus the pre-delivery medical treatment and supplementation.
That is antenatal care. Antenatal care is a pre-delivery care. And also this whole safe delivery, skill attendance, that's an important component of it.
So now would you say that reproductive health is being introduced in India through Janani Suraksha Yojana and so on?
No, currently, earlier also we had something like MCH and family planning program. India was the first country in the world to have the family planning program way back in 1952. Subsequently we integrated MCH, the maternal child health, into the reproductive health. But post-Cairo conference, and that's a watershed in the history, there was this big conference in 1994 where 179 countries participated at Cairo, and there was a program of action which was adopted, to which India is a signatory. So the emphasis has got shifted. Earlier the focus was just chasing the numbers. If you remember those emergency era and all, we were talking of number of vasectomies and tuberculomies and numbers there. Now we are talking of much more of reproductive health approach, serving the women's reproductive health needs, talking of quality, talking of rights, talking of gender equality.